Hi, doctors. This brief slideshow is part of your orientation. We're going to talk for a few minutes about how to complete your charts when you're in Epic so that you can get paid. When you open Epic and begin charting on a patient, you'll see each chart contains templates for HPI, which is History of Present Illness, ROS, Review of Systems, Physical Exam, some detailed exams, and procedures and medical decision making, which is partially hidden there. And we use those to support our level of care that we're billing. As you begin charting on your patient, at the top left you'll see HPI, or History of Present Illness. That template will guide you to click through each item that pertains to your patient. Each detail you record counts towards a more thorough chart and supports your level of billing. Here we have location of pain, quality, severity, duration, timing, modifying factors, and so on. The Epic template will allow you to click on or fill in blanks for the details you add. Here we have where the pain is, the quality of it, how long it lasts, and so forth. You'll want to add as many pertinent details on your history of present illness as are pertinent to your patient. You'll also be supporting your level of charge. The more details you add, the more you'll support your level of charge. For example, if you add 4 or 5 items or details to your chart, you will have already met the minimum requirement to support a level 4 or a level 5. The next template after HPI is the Review of Systems, and you can see in Epic you'll be allowed to click as many details as you see fit there. The Epic template has 14 systems that you can detail. And again, the more systems you chart, the better support you'll have for your level of charge. The individual systems that are pertinent to your patient should be documented with positive and negative responses according to the rules. However, for the systems that are not pertinent to your particular patient that you've examined, you can check a box that says all other systems are negative. As we all know, sometimes you're not able to obtain information about a patient for various reasons, and you'll see how we chart that. The Review of Systems template has a place for you to check a box that says unable to perform Review of Systems. It gives you a list of choices for why you should click one of those and move on. Now, the past history, family history, and social history are drawn from the nurse's notes and are recorded automatically into the physician Epic chart. As long as your nurse records those, they will be counted towards your charting. And the way you note that is to click the box that says Nurse's Notes Reviewed. Your chart will then reflect the past medical history, for example, hypertension, diabetes, patient's allergies, and whether or not they drink, smoke, and snort. The place for you to acknowledge that is to be found under the physical exam template, not the Review of Systems template. So as this little screenshot shows, you click Nurse's Notes Reviewed under Physical Exam. A larger view of the Epic template for physical exam shows your physical exam documentation. The number of items you click increases your support of your level of charge. There are 12 body systems that are chartable in Epic, and the number of individual body systems you chart should be sufficient to support your level of care. So for a level 3 level of charge, you should chart on 2 to 4 body systems. For a level 4, 5 to 7 body systems, and a level 5, 8 body systems should be individually charted. Epic gives you an opportunity to document the level of medical decision making that you've made. In this screenshot, you see what that looks like. Here you're given an opportunity to click on what you did in terms of medical decision making. The template contains 3 sections: risk, data reviewed, and problems. For risk, you'll click either low, moderate, or high, depending on your opinion of whether or not you thought the patient might get worse, the problems presenting, and how severe they were. For data reviewed, you'll click the boxes relevant to what you did. Old record reviewed, discussed with consultants, they each have a click box you can hit. For problems, Epic template gives you a blank box that you can type into. More on that in a moment. When you're clicking on your level of risk, remember that your level of charge will be supported based on whether you actually document a moderate or high level of risk. When you do order a large workup and speak with consultants, you want to document that you've done those things because that supports your level of charge. In the Epic template for medical decision makings, the problems area is blank. If you've already filled out your risk and data reviewed, then you've met the requirement and are not required to put any more information. If you want to put this in, you'll type it in yourself. The folks who review our charts for billing use a system that is so complex that we just couldn't possibly understand it, so we're going to move on.